Welcome back. About 37 million mammograms are performed in the U.S. each year. They have long been thought to be the best way to detect breast cancer. But recent studies have cast doubt on whether or not the tests are really saving lives. And some believe that the radiation from the test can actually increase some women's chances of getting breast cancer. Here to debate the pros and cons of mammogram testing are Dr. Stacy Vitiello, a radiologist who specializes in breast imaging, and Dr. Christine Horner, a breast reconstruction surgeon. Hi, ladies. Thank you so much for coming. So this is going to be interesting because we have two completely diverse ideas about mammograms. And I am unconvinced about either. So, Stacy, please tell us you are pro-mammogram.
I certainly am
Why?
Pro-mammogram. I see every day the effects of what happens when women don't go for mammograms. And those are the days that are the worst days in my practice. Everyone knows what they should be doing to lead a healthy lifestyle. Not everyone does it. We're human. And I think that in order to catch the cases that can't be caught with a healthy lifestyle, we need to absolutely continue mammographic screening.
Dr. Horner.
Yes.
You disagree with mammograms.
I do.
Tell me why.
Well, you know what's happened is that we've had a lot of studies that have come out recently that have all come to the same conclusions, which is that mammograms do not show any increased benefit over women just doing physical examinations. So there's not a change in the mortality rate, no difference between mammograms and physical examination.
There is this question about radiation. It's the big elephant in the room. Everybody's talking about the fact that these breast cancer tumors could be responding to the radiation. It could be making them worse. So is there anything else that you recommend besides mammograms?
Well, yes. I'd first like to say that there definitely is a good amount of literature that shows that mammograms do actually save lives. I absolutely believe in the efficacy of mammography. However, it is not a perfect test by any means. For women with dense breasts, especially, which is 40% of the population over the age of 40, mammography will not show many tumors. That is absolutely true. And so at our practice, we take breast density very seriously and recommend an additional screening test, breast ultrasound, or breast MRI, depending on the patient's risk factors, to give them another chance of finding their cancer in time.
Dr. Horner, you have an answer for that. I see you chopping at the bit. Go ahead.
There's a lot of problems with mammograms. So first of all, mammograms are not good for people who are small-breasted, large-breasted, have dense breasts, have implants in, have reconstructed breasts, or also not beneficial for people who are young. Next is that it overdiagnoses. So there's a big reporting issue with this, and all the research is showing that 20 to 30% of the indications as far as if you've got cancer, it's an overdiagnosis, meaning it's diagnosing something that isn't breast cancer and leading to overtreatment. So women are needlessly having radiation, surgery, even chemotherapy for that can be extremely damaging, for them. So doing other tests that do not use radiation is what I'm an advocate. So ultrasounds, as she discussed, but there's more sophisticated ultrasounds like 3D ultrasounds. There's also something called elastography, which measures by color how flexible or elastic a cell membrane is, and the stiff cells will, show up a different color than the ones that are soft.
So when you're talking about the color mode, the blue is one elasticity, the green is another, the red
is another.
Okay.
So you can actually pick up things as small as 1 millimeter on that, which is better than what a mammogram can do. Then in addition to that, there's a physiological test called thermography. So thermography is based on heat and blood vessel patterns. And so what happens is
which is this here.
Yes. So what we find is, this is normal. So what we find is that before a woman starts to develop a tumor, so long before a tumor even starts to develop, there are new blood vessels that start to grow into the area. They're not normal, though. They grow in abnormal patterns. They produce an abnormal amount of heat. When we see that, we can tell women, hey, there's some things that you can do to help to lower your risk, which is what my passion is teaching people about that through diet and lifestyle and supplements and so forth. And we can see changes in 6 to 8 weeks, getting complete reversals.
Thermography is useful as a complementary test
to a mammogram.
Perhaps. it is not FDA approved as something that can be a screening test to replace a mammogram.
Okay.
It is FDA approved.
But not to replace a screening mammogram.
No, it's about replacement. It's to do in addition, because it can help to determine which needs to be biopsied and which don't, because mammograms are wrong 80% of the time when they think something's suspicious and it turns out that it's not.
Do you agree with that?
Well, when we biopsy something, it has an 80% chance of being benign, but that doesn't mean that a mammogram is 80% wrong.
But then you're biopsying,
right.
So you're actually cutting into somebody. So is there a way to...
Needle biopsy.
Needle biopsy.
But even with that, there's psychological tests that have been done that show that people who have these false positives, that psychologically 6 months later, their emotional and psychological disturbances are equal to women who have had breast cancer. And 3 years later, they still have psychological disturbances. I can show you the research.
No, I've seen that study, and knowing my clinical practice and my patients who are perhaps called back for additional views or a breast ultrasound, they're able to handle that. Women are strong. They might have felt upset and nervous for a few days, but certainly it didn't affect their life 6 months later. If a woman is diagnosed with breast cancer, especially advanced breast cancer, it's like a bomb has gone off in her living room. We want to minimize the size of that bomb so that the damage to the entire family is minimized. This isn't a women's issue. This is a family issue.
I would never get a mammogram personally.
And you get mammograms?
Oh, absolutely. Absolutely.
Okay. I actually hope that helps make up your mind one way or the other. Stay tuned for Ask Carol. We got some tips on staying healthy that you won't want to miss.